We often hear that exercise makes you healthier, but how and why? A new Stanford study has some answers. Let's go to the gym to find out. We're doing this. There's no magic pill, right?
There's no magic pill. As a field and as a researcher, this provides this molecular map that's going to allow us to generate all sorts of hypotheses about what pathways and interactions with disease, what protective effects are present there. In this study, we looked at 19 different tissues across an animal, and we profiled them with a range of different molecular assays. We see 35,000 different changes. 2/3 of these changes are tissue specific. So we know immediately it's going to be very hard to create a drug that's going to replicate all of those benefits. We can really start thinking about what would be a precision or precise exercise intervention or treatment.
Does that mean you tailor a specific exercise to a specific disease or illness?
I think eventually we'll be able to do that. We'll be able to say, you know, if this is something that you're suffering, instead of saying exercise more, we can perhaps get closer to how many minutes you should exercise. What types of exercise should you do? How is that going to interact with the disease processes that might be happening at a molecular level? We will also have the tools to look at biomarkers of exercise, so we'll know, has that been enough, right? Because we'll be able to see in the blood or other tissues, you know, that training effect with these types of maps.
How does this benefit the patient, to the people watching out there?
We know there's lots of benefits already, but we can see them now at the molecular level. So we can see genes that are changing that we know are responsible for coronary artery disease. We saw changes that are related to non-alcoholic fatty liver disease. We also saw important changes that are related to type 2 diabetes. Endurance exercise is beneficial for your health, your heart, your longevity. I think now how this is going to benefit people is they're going to understand, you know, the why. So really, you know, exercise is the best medicine. I think this is going to empower research for years, if not decades, to come.